We are just coming off of National Infant Immunization Week. It's a good chance to address a growing problem of declining vaccination rates. I recently spoke with neonatologist Dr. Anuj Malik from Trinity Health of New England. He said first and foremost, the pandemic does have a lot to do with it.
They missed a lot of their regular appointments, and the routine vaccinations are usually given on their routine well-child checkups.
And there are a lot of vaccinations that can be missed. The Centers for Disease Control recommends roughly 15 of them in a child's first 6 months. Dr. Malik said the number has made some parents skittish. But remember, 15 vaccinations doesn't mean 15 needles.
These days, there are a lot of combination vaccinations out there. So we have a combination of a couple of vaccines, either Pentacell or Pediarix. They're a combination of like 5 different vaccines in one.
Unfortunately, vaccination rates for diseases like measles and chickenpox have been declining in school-aged children as well. Dr. Malik said it's easy for parents to forget how bad these diseases can be thanks to vaccination making them so rare. But there was also a lot of misinformation surrounding trace elements of heavy metals like mercury and arsenic that can be found in some of those vaccines.
The actual percentage of these heavy metals is to the millionth, such a small amount that the baby or the child is probably exposed to this in their general environment in way larger amounts than with the vaccination in general.
And if your child has missed any shots, don't worry.
Gives you those memory cells. So if they have missed the shot and they feel that they are past the age, there's truly no like past the age, because we have like a nice catch-up vaccination schedule from CDC.
You can find that at cdc.gov to get that catch-up vaccination schedule. I do often feel bad for doctors because I ask them, how do you try to convince parents? Because in a perfectly rational world, all you would have to do is just give them the facts and they would make the right choice. But that's not how people work. They tend to respond to emotion first and facts second, for better and for worse. So, you know, I ask them, sometimes do you think like you want to resort to scare tactics? Like you'll see it online. Oh, if you don't believe in vaccines, go to a graveyard from the 50s and 60s. Well, and you see all the kids who are dying of polio or measles or other preventable diseases that we forget about now. But he says, he just doesn't prefer to go down that route.
I think a lot of parents now, they're looking at more of the research behind it, and they want more than just one person's word.
Yes.
You know what I mean? Parents tend to question a lot more, I think, now than they did back in the 50s.
Because the research is accessible.
Yes.
I mean, it's...
Well, accessible, understandable, and like easy to digest. That's a different story.
That's my point. Yeah. See, I go to the pediatrician, and I can tell you, and this is not going to be a shock to any of you at home, but I know that man is a heck of a lot smarter than I am. Full stop. Yes. So if he says, I recommend this for the kids, I'm going to do that because I trust him with my children's life. So why, you know, if he says, okay, well, it's time for you to get for him or her to get this shot, okay, give him the shot.